Golden hours, be somebody's hero. 70% of the mortality happens at home or in the community. So it's very important that we utilize these golden hours effectively. The community needs to get skilled. So in Sign, we have pledged to educate and the skilled community to utilize these golden hours. CPR, I think, is a must for all. Cardiopulmonary resuscitation, step by step CPR guide. So these are the very simple skill sets which Sign has pledged to teach in the community. Shake and shout if somebody is not breathing enough, or suddenly stop breathing or beating. Place your hands on the center of their chest. Call for help. Push hard and fast, about twice per second. See to it that your elbows are stretched. Check for breathing. And if you have training, repeat cycles for 30 pushes and 2 rescue breaths. Just 13 to 2. If you keep on doing it, you can save life. So CPR training sessions will be starting very soon to skill the community. Road traffic accident. One basic understanding one has to understand in road traffic, you have to support the spine and the neck. It's the most vulnerable. Just support the neck because these are usually whiplash injuries. Chemical injuries. And one chemical injury, one take home message is that whenever there's a chemical, rush to the tap water and remove the chemicals, and that can really, you know, help in long term complications. Eye injury. The most important thing in eye injury, you have to cover with a dressing pad which has to be sterile. Don't use much of fingers. Flush the eye with saline douches and use steroidal cream and rush for help. Brain stroke, very common. Either it could be an ischemic stroke or an hemorrhagic stroke. In ischemic stroke, the blood supply gets blocked, and in hemorrhage, there's a rupture of blood vessel. Usually, rupture happens in accelerated or accelerated hypertension. But whichever the situation, use aspirin 75 milligram and then call for help. Heart attack, suddenly blockade of the arteries, which is supplying the arteries. So the signs are probably choking, exertional chest pain, sweating, drop in blood pressure. If you have a history of heart background, family history, smokers, just use aspirin and take some sorbitol under the tongue, then call for help and shift the patient to a tertiary center. Rhinosinusitis is a very common problem in this part of the world because of the pollution. Very simple thing, using saline sprays, a lot of steam, and a simple gel nethi can help you in a lot of sinus and rhinosinusitis, where there is a congestion of the nasal passage in the sinus spaces. Asthma. If you're an asthmatic, suddenly if you go into an acute asthma, this could be certain triggers. This could be because of food, dust mites, molds, certain polluting elements, suspended particles. Carry your rescue inhalers. If till you get your rescue inhaler or you're not able to reach rescue inhaler, use pursed lip breathing. That means spout your lips, slowly breathe out. Don't crowd the patient. Keep it in a safe side. Relax him or her and make him sit as if when you're sitting, a little bending forward and on a table, so that gives you more space at the bottom of the lungs. Skin allergy is very common. If you have a skin allergy, identify the trigger. It may be food allergy. Use steroidal cream, and prednisolone 40 milligram and Solumedrol 40 milligram is very useful. Immediately start the steroids. Choking. Many times what happens in small child or in elderly, there may be choking because of foreign body. This is called a Heimlich maneuver. Press from the back and just give a thrust. The choking gets relieved. Paralysis. It's a very common problem. There could be because of blood pressure. There could be a heart. This could be because of metabolic problems. This could be other reasons that take the history and accordingly work. Spine injury, if you have got a road traffic accident, see to it that you don't pull the patient, support the spine, roll your hand under the neck and the back and slowly move the spine as if you're rolling a carpet. Orthopedic injury rule is rise, rest, ice, compress, and elevate. So rest that limb, use ice compression for 20 minutes, use compression to reduce the swelling, and elevate 6 to 8 inches above the heart. That reduces the orthopedic inflammation. Bee sting, take out the stinker, treat the local reactions with steroid injections, and watch close for the anaphylaxis. I think if it is a wasp is acid, you can use caustic soda to remove the inflammation. If it is a bee, it's a base, you can use vinegar to reduce the inflammation. High fever, the most important things, any fever which is less than 100 doesn't need any treatment. If it is more than 100, you tepid sponging, or you can give tap, water rush tap, you can put under the shower, or good amount of soaked bed sheet in tap water, wrap the person so that you have to bring down the core temperature, and use paracetamol. You can go up to 1 or 2 grams of paracetamol a day. Dehydration, the most important thing is the loss of skin triggers. Pinch the skin and see. And in elderly people, they lose very fast. See to it that they get enough fluids, and ORS is the right choice. Hypoglycemia, those who are diabetic, they can suddenly faint. If you have anxiety, sweating, suddenly feeling giddy, maybe there is a drop in sugar, use candies. Hyperglycemia, usually they have 3 P's: polyphagia, polydipsia, and polyuria. Usually they urinate more, they are thirsty, and they always feel hungry. So check your sugar accordingly. With the insulin, we can bring it down. In an unconscious patients in paralysis, which I mentioned, this is called recovery position, that will prevent aspiration of the food. This is the position you have to support the head, and between the 2 legs they use some pillow so that there is no aspiration. Thrombophlebitis is another common problem with those who are sedentary. So one can use some and steroidal cream, or some kind of anti-thrombotic ointment like Thrombophob, etc., and raise the limbs. One can use some stockinets also to reduce the inflammation. Later on, one can refer to a specialist for further evaluation. GERD, this is a very common problem, gastroesophageal reflux. Usually the lower portion of the stomach and the food pipe, they don't have any proper lead, so usually it's a functional closure. Those who have been alcoholic, those who have been irregularly eating, and those who have been taking a lot of oily foods, or those who are smokers, they usually have problem, and they then mimic a cardiac complication. So whenever you have high level of reflux, you have to rule out other comorbid like heart, etc. But the treatment of reflux is that small frequent meals, head and raise before going to sleep, and walk a mile after a 9. That means so that the food goes down, and stress management. Snake bite, whenever you have a suspected snake bite, that the site above the bite, one should tie it properly so that the venom doesn't rise up. That is the only thing. You're not supposed to suck it up. Dog bite, there are different levels of dog bite. The one golden rule of dog bite: keep the wound open, use soap water, and anti-rabies injection if the dog is not immunized. Acute retention of urine is a very common problem because of the prostatic enlargement. So many times a simple catheter can help you relieve, which is very easy technique. Otherwise, we can train the people to do it, but otherwise take them to a tap water, make them sit on a chair, and the sound of the water can many times relieve the retention of urine. It's a very common problem with elderly people. Constipation is a routine problem because of the hard stool. They need to be educated. They need lifestyle modification. Excessive laxative usage is bad. Bulk laxatives, is useful, and high fiber diet. These are very useful, right kind of water content, but sometimes they need manual evacuation. But one simple rule is that dry it in a cup of milk before going to bed is very useful, which works as a bulk laxative. First aid in burns are very important. The burns, never try to, fiddle with the blisters area. Skin is the best dressing. Cover with a clean gauze pads. Use an emollient cream or a sulfur sulfidizing cream lotion. Remove the jewelry because that can obstruct the circulation. Use a clean pad, and don't try to remove the blisters. Stress management is a very important, in the post COVID, people are still having a lot of anxiety and hyperventilation. Progressive muscular relaxation is very important technique. Everybody should be practicing and some group breath meditation on a regular basis. Wound care is very important. The three things one should carry always as a part of fasted management at home: the betadine or iodine, spirit, and Savlon. Cover with the soap water or Savlon, then spirit, and finally with the betadine. That is enough for the wound care. Splint, this one can use dupatta or some kind of shawl for dupatta if there is a shoulder or the clavicle injury. Different bandaging techniques are shown here. We can skill people for different bandaging techniques. Thank you so much. This is basically an awareness so that these so many things we can do in the community, right from CPR to small fasted things, so that community at large can be educated enough and they can help people in the neighborhood and also help themselves. Regards, Dr. Bose, Medical Advisor, sign.